Thank you. Well, I have never had an applause before I've spoken, ever before. That's kind of bizarre. Okay. Well, I've got to squeeze about 2,000 years of endoscopy into 30 minutes. So, and what I was going to do is, because usually when I get to ask to give a presentation, I usually ask, so I gave a presentation to the American College of Radiologists in October. And so I asked them how many people were radiologists or specialists in the room, and everyone puts their hands up, which makes it very frightening to me. And so, how many people are medical illustrators in the room? Exactly, right? So I feel terrified now that I'm supposed to be talking about a subject that I know very little about, and I depend on the skill of others. But so I was going to give you about 15 minutes to give you some idea of what I do, basically to kind of give you an idea of where my perspective is coming from. And I thought I'd just choose one example, one project that I was involved with, which I thought was pretty cool. And so I've basically focused on that for 15 minutes. And then I was going to give you some examples of some of the illustration work that I have never done. I don't have an artistic bone in my body, but I know people that do. And that's the important thing for me, is I know where I can get this work done. So basically, endoscopy is looking inside. How many people have had an endoscopic procedure? Don't tell me what you've had done. I just want to know whether you've had anything done. Right, so a lot of people have enjoyed the benefits of endoscopy. And it was Hippocrates, who was known as the father of medicine, who was a brilliant guy, a true Renaissance man, if you like, did a lot of different things. He came up with the first description of an endoscope that I could find, which was a candle-illuminated rectal speculum. Think about that. He's supposed to be bright, but I'm not sure you want to go near someone's rectum or anus, who obviously has large intestinal disease, because why are they going to him anyway, with a naked flame. I'm not sure that was his brightest idea. Professor Hopkins in '65 came up with the rod lens telescope, and now we have high-definition systems, 4K systems. There's even 3D holographic systems that are being developed in the human side. And so we have a whole variety of clinical equipment that we use in the hospital. We also use it for research, publications, and a lot of the material that we generate we can use for teaching as well. And we're pretty much able to scope anything from a 10-gram turtle up to about a 6,000-kilogram elephant. So there's a lot of scope in zoological endoscopy. So this is one project to give you an idea of what I do and where my perspective is coming from. I got a phone call asking if I could go and help them sterilize hybrid Galapagos tortoises for release onto an island of Pinta to engineer recovery. I had no idea if I could do that, but I could sniff. There was the smell of a free trip to the Galapagos, and so I said I could absolutely do this. So we took a team down, but this is the Galapagos tortoise. It's the largest living tortoise, gets over 400 kilos. And these giant tortoises are the major herbivore on the island. So they engineer the landscape. They create these grassy areas. They are the seed dispersers. They are the only large herbivore on the island. And unfortunately, that wasn't until people screwed it up for them. So back in the 16th century, these animals numbered over 250,000. Now they're down to about 20,000. They were hunted for meat and oil. There was habitat clearance on some of the islands for people to inhabit. And then there was the introduction of vermin and invasive grazers, of which the goat was the worst example. Some bright seagoing captain back in 1700 and something had the bright idea of releasing 11 goats onto the island, hoping they would breed and they would always have a supply of goat meat whenever they were sailing past the island. It worked very well. There was 52,000 of them in the 1990s. And you can see here's an exclusion fence. This is an ecological technique. So you put an exclusion fence up, and so here you can see the vegetation that the goats can't get to, and here you can see the vegetation that the goats can get to, right? So it gives a fairly clear indication of the problem. This is Lonesome George, right? He was the last remaining tortoise they found on the island of Pinta in 1972, and that's Lonesome George with me in 2008 or 2009. He subsequently died in 2012. Lonesome George is a bit of a misnomer, because when I saw him, he was kept in an enclosure with 3 or 4 rather attractive young female tortoises. So I don't think he was really lonesome, but he certainly wasn't able to reproduce. And so they undertook an eradication program. They eradicated all these goats, 52,000 of them. They slaughtered all these goats across the island to clear the island, and they wanted to repatriate the large herbivore because with all these goats gone, this island started to overgrow. You had all these shade-loving plants that took over. There was a need to engineer an ecological recovery on this island. And so they wanted to repatriate the large chelonian, the large tortoise herbivore on the island, and they had a group of hybrid tortoises. So these were tortoises that were basically crossbred between the different islands in the 1970s, 1960s, before they realized they were different genetic breeds that occupied the different islands. So they are, from a conservation perspective, crossbred. They're of no value. So they've been hiding out in rather poor zoo situations on Santa Cruz. So they asked if we could sterilize them. They could be released onto the island. They could fulfill their ecological niche, but they couldn't breed. So when they get the high genetic stock bred, they could release those animals onto the island, and there wouldn't be any interference. So I took a team down. We went from Atlanta, Houston, Quito, Guayaquil, Boltra, Santa Cruz to the Darwin Research Center. So this was about a 24-hour trip to get down there. And I'm used to working in that marvelous hospital you see next door, that $100 million state-of-the-art facility. This was the operating facilities that we had on Santa Cruz. I want you to notice that tire, because that became our giant tortoise surgical restraint device. So we took down a team. I had a zoo vet from Zoo Atlanta, myself, one of my graduate students and a student, and these animals were weighed, anesthetized, and there's a lot of difficulties with zoological medicine. We don't usually work, there's a whole variety of species. So even if I work in a nice hospital environment, I have no idea what's going to come in through the door on Monday morning. No idea. Someone could bring me an anaconda, someone could bring me a chinchilla, someone could bring me a giant tortoise. I have no idea. So we have to be flexible. So we were working on the island here. We didn't have gas anesthesia. We were having to use injectable drugs. And here's a quick video just to give you an idea of what we were dealing with. So this is one of these giant tortoises. This is about a 90-kilo female. She's been anesthetized with injectable drugs. I should have probably thought about showing surgical videos immediately after lunch. I didn't give that as much consideration as I should have done. If anyone's squeamish, I'll give you about a 3-second warning when you might want to look away. So you can see two surgeons, and trying to operate through the shell of these animals to remove the ovaries, to sterilize them, would be so difficult, so problematic. We'd probably have significant morbidity and mortality, something I always would try and avoid. So we were doing an endoscopic approach. So this is probably an 8-centimeter surgical approach to the prefemoral fossa. And once we've made the incision, we would then go in with our 5-millimeter endoscope, so it's our kind of camera system. And you can see my headlight moving around because we're not in a surgical facility, so we've got headlamps to give us illumination. So we're inside the animal's body cavity now, and you can see, actually you can just about see there's an ovary just coming into view there. So we would take a look, and when we can identify the ovarian tissue, we can then put these forceps in, and we could exteriorize and pull out the ovary and then perform a removal. And so this was using these telepacks, these mobile endoscopy packs that we use when we're in the field. So this was a technique that we could use, and these endoscopic techniques have really revolutionized the way that we can work with zoo and wildlife species, because unlike domestic animals or people, you can't sort of, tell these animals to, inspect their incisions and keep them clean. You can't encourage them necessarily to, come back to the doctor in 3 days for a wound check. And so you need to be as little or as minimally invasive as you can. So we go in with our forceps, we pull out the first follicle. Now, ladies in the audience, your ovaries are about the size of my thumbnail, right? Quite small, usually. So I want you to just look at this and consider the size of the ovary in this reptile. And so we're pulling out all these follicles, and I'm thinking to myself, and we had buckets and buckets of ovaries, because we had about 39 animals to do, and you can see the size of this. That's one ovary that's come out there. And the advantage of these endoscopic techniques is that we are not exposing anything inside the body cavity to the outside world, right? So everything that's exteriorized gets ligated and removed. So there's a greatly reduced chance of introducing infection. And bearing in mind, we're in a field surgery site on the Galapagos Islands, so we don't have all the sterility that we would hope if we were working in a normal hospital. And so we would be able to remove these ovaries, close these animals up, and they made a very good recovery. And there was lots of ovarian tissue. I tried to come up with like some sort of recipe. I don't know, Galapagos flan or a key lime pie or something, because there's a lot of yolk material there that seemed to be going to waste. So anyway, these animals, we had no complications. 39 were then translocated from the Darwin Research Station to the island of Pinta. They then had telemetry over the last sort of 10 years. It's coming up for their 10-year anniversary. They have been engineering a recovery, and the Galapagos Conservancy is trying to find other populations of poor genetic material that we can sterilize and put onto these islands to help engineer recovery while they're trying to breed these high genetic stock. So this was nice because it gave us the ability to use these endoscopic techniques for a conservation project. But really, one of the other reasons why I like to show this project is it was in 2010. They were celebrating the 150th anniversary of the publication of The Origin of the Species by Charles Darwin. So I'm an Englishman. I'm on the Galapagos Islands 150 years after Charles Darwin was on the Galapagos Islands doing his work, and I'm drinking wine at one of the events with that guy who is Charles Darwin's great-great-grandson. I still get goosebumps when I talk about it. Does not get any better than that. So that gives you some idea of kind of where I'm coming from as a zoological veterinarian. And then there's a huge variety of anatomy that we have to appreciate and that we teach our students. And so here's a traditional kind of schematic showing the reproductive tract of a male lizard. And on the right, that's a necropsy of a male lizard. Again, they don't have like a scrotum hanging down. Reptiles, they have their testes in their body cavity. So here you can see, here's the kidney, vessel, testis, adrenal. And the diagrams that we've had previously have been relatively simple. Well, I've been very fortunate to work with some skilled medical illustrators here, and so we managed to get a contract with the publisher so we could develop some, I think, more refined medical illustrations, color, showing those 3D perspective techniques that I think help to enhance the learning, whether it be a veterinary student or whether it be a veterinarian. And so comparing a necropsy with an image, that's one thing. And you could say that, well, a photograph may be, equally valuable. But one of the beauties of medical illustration, which you guys get to do, is that you can, I think, give and convey concepts for which there is no single anatomical picture or image that you could use. For instance, this is another one of the book pictures, and you can see there the anatomy of the egg. Anyone that's tried to dissect an egg and take a photograph to demonstrate those kind of membranes, it's pointless. It's a nightmare. It's just horrendous. So with a medical illustration, we can actually do something that we can't even get with a photograph. The picture on the left, reptiles do not grow their skin like mammals do. So fairly frequently, as a reptile grows, it has to shed its skin. And so that process of skin shedding is a dynamic process that takes place over about 10 to 14 days. So again, we can use a medical illustration showing the resting and showing that transition, that physiologic change, that anatomic change over 10 to 14 days in a single medical illustration. So another example that I quite liked. And being able to sort of consolidate and convey some rather complex structures like vasculature, being able to distill those down and take out all the peripheral anatomy helps to target, I think, the audience into identifying some of the salient features. In this case, looking at the vasculature of a lizard on the left and a chelonian on the right. And again, another example showing how we can now ghost some of those images. I don't know, I feel horrible talking about this stuff because you guys already know about it. And you're probably telling me off, he's using the wrong term. Did you hear what he said there? He used the wrong term. So please, just bear with me. But it's difficult. We couldn't find many of these images. There is anatomical descriptions, and so I ended up having to work with the medical illustrators and go and try and translate a medical description from a dissection into an image. And Kip Carter is someone I've worked with most consistently. And there's a lot of back and forth. I'll send him images, and then he'll send something back, and I'm like, Kip, that's completely screwed up. And then I send it back, and he says, well, that's your fault, because you told me this. And then, anyway, there's a lot of discussion that goes back and forth, trying to get those anatomical descriptions into an image. And, for instance, the renal portal system, so unlike you and me, reptiles have a renal portal system. So there's a blood supply that actually comes from the venous circulation to the peritubular network. That's unique to reptiles, some birds, and some fish. And again, being able to that's the first time I could actually find a medical illustration that actually had shown that, and I'm not even sure if it's right. It's my interpretation of the anatomy, which was accurately portrayed by the medical illustrators, but I think it is. But it's important that stuff wasn't truly available. And then, in addition to anatomy, the other thing I tend to do is teach surgery to students and also to veterinarians. When you take that complex photograph of an operation, there is so much stuff going on. I mean, there's so many bits of equipment and things that it's very cluttered. It's very difficult to distill. But with a medical illustration, they can take out all of that clutter and really focus on the essential elements of what you're trying to convey. In this case, looking at the ergonomics of the surgeon facing the monitor and the position of the reptile. There is a tendency at ERC, here at the University of Georgia, to either portray the reptiles as being particularly large and giant or the surgeons as being midgets. I'm not quite sure, but there is often a disparity in size, but this is obviously a giant tortoise. But those medical illustrations help to distill that down. Oh, this is a nice group. I usually don't get the R's for reptiles. You're looking inside the coelom of a 10-gram turtle. This animal is the size of a quarter. You're looking inside with an endoscope. You can see the intestinal tract. You're looking at the lung there. That's Merkel's diverticulum, that thing that just went past, where the yolk sac attached. That's the gonad. You can tell this animal's a very immature female, so we can do gender identification. And to give you some idea of the visual acuity of these endoscopy systems, I'm going to focus in on the immature oviduct, which you can see in the middle there. You can actually see the erythrocytes coursing through the capillaries. Right? How cool is that? This is why I like lecturing on endoscopy, because it makes me look good, right? You guys are all impressed at the image. All I did was hold it. And so using medical illustration, we can help to provide some kind of perspective as to where organs are located, because one of the biggest problems people have when they're learning this is how do you portray where those structures are when you're going around with this camera system and looking around. And so medical illustration has been very useful for us to do that. Or when we're demonstrating taking biopsies. So at the top, we're taking a liver biopsy from an iguana, and from the bottom, we're taking a kidney biopsy from a chameleon. And yes, the videos have their place. I use them. Some people are now getting a bit squeamish. We use them to teach the technique, but with medical illustration, I can actually show the orientation of the telescope with the animal's body and actually show the position of the organ of interest that you're taking a biopsy from. I can't create that image in a photograph or with a video. The only way I can do that is with a medical illustration. I say the only way I can do that. I never do anything. You know, the only thing that I do about medical illustration is I click on the email and then click Save As and then put it on my hard drive. That's about as much as I get to do. Again, here we're doing an endoscopic surgery in an iguana. And that's a typical surgical photograph. You can't really make out what's going on. You can't really determine the teaching concept we're trying to get across. But by using a medical illustration, we can show the triangulation, who's holding which instrument, and I think it makes life very, very clear. And this has become critically important to us because we run the only 3-day endoscopy course basically on the planet. We had a course in December. We had people from South Korea, Norway, Germany, and Mexico, in addition to North America. And I think it's these illustrations that really help to teach some of these complex surgical procedures. Here's another example. This is a resident research project, and you can see the picture shows that it's a very sort of complex situation. You've got these Lone Star retractors, you've got devices that are being positioned, but by removing all that background and relying on the medical illustration, it gives you some clarity. And then there's also, in fact, let me see if I can do it with this. See if I can do this. No, I'm not that. I've had too much coffee. No, I don't. Or, here's a snake having surgery. There are issues as to, well, where do you make the incision in a snake? You need to know your anatomy. But trying to explain going through, and a snake celiotomy is actually just as difficult, if not more difficult, than a chelonian, because you have such complex muscular layers. And to be fair, I don't think I really understood the orientation and the interaction between these muscles. I was a surgeon. I'd be like, cut, another muscle, cut, another muscle, and I would keep going till I got into the body cavity. But when we started to look at some of the original anatomy and some of the drawings, they were line drawings, but we were able to get them converted, and with color and providing that sort of different layering gives people an idea of how complex some of these systems are. The reptile cloaca. We think of reptiles as being quite basic, a precursor to mammals. Well, reptiles have a cloaca, so basically the gastrointestinal tract, the reproductive system, the kidneys, all enter into that single chamber, right? That's a pretty clever, nifty piece of equipment they've got there. Trying to actually understand the complex interplay between those different structures coming in to that cloacal anatomical area is extremely difficult. I've actually only been able to really appreciate it with an endoscope. Literally, with an endoscope, it's like you're in there swimming around inside the cloaca, being able to look at all the different parts. And so we can use an endoscope to visualize. So we've actually just got into the bladder in that turtle. In fact, you'll see as we look in this animal's bladder, that's the heart beating. It's a big bladder. As we look down, here we go. Any idea? I know you're not veterinarians, but you wouldn't want that in your bladder. That's a parasite. In fact, I think there's a whole party of them somewhere. Where are they? Oh, there they are, look. They get all very excited when they see the endoscope light source. They don't expect anyone to turn the lights on in there. But again, the original diagrams that we could find in the textbooks were quite rudimentary and didn't really show the interplay as to how these areas go together. But by using our endoscopic images and video, getting with the medical illustrators, we're able to really come up with something which is much more accurate, and it conveys the importance of, well, how do you perform an endoscopic exam? How do you perform a cystocentesis? How do you perform bladder catheterization versus an enema? Because there's one hole that you need to make sure you can navigate. Another example, this is using endoscopy. This is again, you see that endoscope going into the bird. I don't know why that video is not working. Here it is. You can show this video, you can show this picture, and you can show that endoscope going in, but it's difficult for someone to actually learn, well, how do I do that? It just seems to be going into the bird. Well, by combining the video with medical illustration, we can show the orientation of the scope, and then on the image at the bottom right there, we can show the orientation of the flexor curis medialis muscle, we can show the last rib, we can show the pubis bone, we can show the entry point. So I think that there are things that medical illustration can do that nothing else can do anywhere near as well. Trying to explain the effects of insufflation on lung function. There is no video that really can show that. There's no picture or photograph you can take to show that. You can describe it, but with a medical illustration, I think you can really convey those concepts so much more easily. And again, a surgical photograph or video, there's a lot going on. There's a lot of complex interactions that are happening, whereas with an illustration, you can basically pull those essential components and focus on what you're actually trying to get across. Just want to finish with this picture because this is a photograph for some research projects. We developed some avian endosurgery techniques about 10 years ago, and we published a paper. And it's rare that I get any emails about congratulatory emails or about papers that I publish. Usually if someone writes to me, it's to complain that I've screwed up somehow. So I don't usually get things saying how good it was. I got 6 emails after this paper was published. 6 emails. All 6 were basically complimenting Kip Carter on his medical illustration. No one said anything about my fabulous narrative. No one said anything about my incredible research investigation methods and material. Nothing at all. All about the pictures. But again, you see how we can take that photograph, because that's what I would have put in a publication before, but the medical illustration just creates a clarity that you can't achieve in any other way. And this was another resident who did a recent project looking at gastroscopy in birds, and she was using pigeons as a model. And again, there's a lot going on in those surgical areas. And, but you can see with the diagram, we can actually show the gastrointestinal tract, we can show the bird's position, we can show the endoscope coming down into the stomach and where its position is for taking a biopsy. You just can't achieve that any other way. So, the goal of medical illustration, as far as it works for me as a clinician and as a teacher, is to convey complex medical and surgical concepts and processes in a more easily understandable manner. And I think that the success of my presentations and publications is in no small part due to the work of our talented staff we have here at ERC at the University of Georgia. Basically, their high-quality medical illustrations make me look damn good when I'm standing up in front of people. It's true. And I don't think I've ever really had the opportunity to publicly say it, but I do want to say to our friends at ERC that we are extremely grateful that you are here. You are probably the most unknown resource, I think, available on campus a lot of the time. And I think we need to try and increase your exposure because, again, the comments I got from our book that was published last year, lots of comments about the quality of the illustrations that were in that textbook. And again, it's all down to the team at ERC. So I appreciate you and thank you for all your help. And I will be back here at the break in case anyone has any questions, but I thank you for your time and enjoy the rest of the conference.